A 45-year-old man presented to his clinic with a 6-month history of persistent right-sided nasal congestion and facial pain. He reported that the symptoms had worsened over time and were accompanied by occasional nosebleeds and reduced sense of smell. He denied any significant fever, but noted that the nasal congestion did not improve with over-the-counter decongestants. He had no notable medical history and was a non-smoker. On examination, there was noticeable swelling and tenderness in the right maxillary region. The physician, suspecting chronic sinusitis, prescribed antibiotics and advised the patient to return if symptoms persisted or worsened. No further diagnostic imaging was performed at this time. The diagnostic error here involves the failure to consider or further investigate the possibility of a nasal or sinus tumor as the cause of the unilateral symptoms. Persistent unilateral nasal congestion, facial pain, especially in the presence of a mass on nasal endoscopy, can be indicative of serious conditions such as adenoid squamous cell carcinoma, lymphoma, or inverted papilloma. Given the symptoms and the finding of a nasal mass, it was critical to perform further diagnostic workup, including imaging studies like CT scan or MRI of the sinuses and possibly a biopsy of the mass. These steps are essential to rule out or confirm the presence of a tumor, which would require different management compared to chronic sinusitis. The lack of immediate and thorough investigation could delay the diagnosis and appropriate treatment of a potentially malignant condition, impacting patient outcomes and prognosis.